I'm good.
I learned within chapter 15, group therapies can be as an easy way to express feelings and thoughts about a situation in more ways than one. From the section within the chapter, it states that by having group therapy, people can learn and get different perspectives of what others think about a person or a situation or the things that are involved. In the chapter, to do the group sessions, you can have it private, family, or in a support group method. And it's cheaper also because you get to use one therapist and express each thought and a lot of fun time. The support group aspect of it is usually about a certain situation or a certain person, addiction like heroin or alcoholism, anonymous, or narcotics. Many secrets can be told within a group setting, and noticed behaviors are explained while they're active in the home or in the workplace, and etc. From personal experience, I had a couple of family sessions and I learned about why certain things were going on and about the anger and stuff was expressed from the household.
Here we go.
All right. Cybertherapy. Cybertherapy is offered to the people on the internet. The pros of it is the internet is easy to use, it's a lower cost, and it's relatively anonymous. The cons are the therapist has no access to body language or vocal tones, which helps the therapist accurately judge how a patient feels physically and emotionally. I have attended a few sessions with my grandfather when he started having flashbacks caused by PTSD. It was encouraged to bring a family member to help cope with hearing other people's experiences that were quite similar to his. Biomedical therapy. There are 4 basic categories of drugs used to treat. They are antipsychotic drugs, anti-anxiety drugs, anti-manic drugs, and antidepressant drugs. These drugs, although used alone, are sometimes used with some kind of psychotherapy. Electroconvulsive therapy. In the past, this type of therapy was used on all sorts of mental disorders. In today's age of technology, we have learned the correct uses for it. It is only used in the most humane way, although a major side effect is memory loss. Many patients, though, have a full recovery.
My name is Melissa Schwartz, and I'm here to discuss different therapies used to treat phobias. The number one therapy used is classical conditioning therapies. There are several different forms. The first one that's used to treat phobias is systematic desensitization. And this is a technique used to treat phobias in a very slow and... So this technique is where a client is asked to think about the fear, whatever that is they have a phobia of, and they are actually taught relaxation exercises. So when they're presented with their phobia, they start to practice this technique, and it helps them work through it. It's a very gradual process. The next one is aversion therapy, and in this technique, the client is actually exposed to an unpleasant stimulus when they encounter their fear or their phobia, so that by association, it's an unpleasant experience. It's made to help control behaviors. Form of classical conditioning therapy to treat phobias is exposure therapy, and this is a behavioral technique used to introduce a client to its fear or its phobia in a very sudden and drastic way. Exposure therapy is a behavioral technique that's used to introduce a client to a situation that is related to his fear or phobia. The exposure to the fear for the client, it can come as a form of visualizing their fear, or virtually seeing their fear, or actually being physically exposed to their fear. And if it's in a dramatic way, sudden way, it's called flooding. And this is actually to desensitize the client to the fear. The one classical conditioning therapy that I'm familiar with or was exposed to is through my father, who is an agoraphobic. He was diagnosed with this in 1994, and he has multiple issues that he has to deal with. In fact, he has depression along with being agoraphobic. With him, it's situational. His phobia is of being in a social setting and not being able to escape. So some of the therapies that he's encountered have been, some have been flooding, as far as a sudden introduction to his fear, which didn't work for him. So more of the systematic desensitizing has been better for him because it's at his own pace. And with him having depression and some other general problems, it's just suited him better. Each agoraphobic is different, and what they fear or what their phobia is. It also affects the family because we have to make arrangements for him to go places. I'm a hairstylist. If I do his hair, I have to wait till the salon's closed and no one's in there, and then I take him in alone and I'm able to cut his hair. So it affects the whole family.
Early treatment. Asylums were the places in the early days. The first truly organized effort to do something was in England called Bethlehem, later known Bedlam. Philip Pennell started the movement of humane treatment of the mentally ill. He personally unchained many inmates in France. Dream interpretation of psychoanalysis. Freud believed that his patients used their unconscious thoughts to prevent anxiety. Dream interpretation is the analysis of elements in a person's dreams. Manifest content is the actual dream, and latent content is the hidden symbolic meaning. So for the manifest part of my dream, I'm at the circus running for my life, and for the latent part, I'm deadly afraid of clowns. That's why I do not like going to the circus, and the hidden meaning there is I hate clowns.